Okay, guys, I think we should start now. Hi, a very warm welcome to all of you. We are Team Plan Cover and we are your insurance partners. We take care of your organization's insurance needs. Apart from insurance, what really matters today is the overall well being of the employees. It could be physical well being, it could be mental well being. Stress is an unavoidable aspect of modern life, but it can have a more profound effect when combined with neurological conditions. This webinar aims to provide a deep understanding of how stress interacts with neurological disorders and the strategies that can help manage this complex relationship. All of you will learn about the importance of reducing stressors, the role of cognitive behavioral therapy, and the benefits of lifestyle changes like exercise and meditation. Today, we have with us Dr. Kadam Nagpal. He is the head of consulting in neuroimmunology and movement disorders at Manipal Hospitals, Dwarka. With over 14 years of specialized experience, he is an expert in autoimmune neurological disorders, Parkinson diseases, and related movement disorders. Dr. Nagpal's qualifications include MBBS, MD Medicine, DM Neurology, and prestigious fellowships from the European Neurology Board and Royal College of Physicians, UK. His compassionate approach and dedication to the personalized patient care has earned him a stellar reputation in the field of neurology. I'm handing over now to Dr. Kadam Nagpal to take this session forward. Over to you, sir.
Thank you for such an elaborate introduction. And it's always great to interact at the level of corporate workplaces, right, where people are so very busy, engaged in their office chambers, right, and yes, stressful environment is all around us, right. And in spite of a stressful environment, we see that the neurological disorders above it acts like a double whammy. With this particular presentation, I would just it would be more or less it won't be a monologue, I would think so, because that won't be right to justify this particular topic because it has to be a dialogue. So I'll just skim through a couple of slides which I had prepared on this particular topic, and then I would be open to all the questions from the entire diaspora so that I'm able to answer whatever the real time issues are. So I was told to incorporate this particular presentation because prima facie this falls into the category of a psychologist or a psychiatrist domain, where when the stress comes into place, we really need to understand what exactly a neurologist is we talking about, right? But in presence of a neurological disorder, stress is something which has to be looked into in a very profound way, in a very intense way. And if there is stress, it has to be dealt appropriately and timely in the incipient stages. So I'll just go down to the presentation now. So what exactly is stress? So stress is basically defined as an internal state which can be caused by physical demands on body, disease condition, exercise, extremes or temperature, or by environmental and social situations which are evaluated as potentially harmful, uncontrollable, or exceeding our resource for coping. The physical, environmental, and social causes of stress are termed as stressors. So, as defined by Lazarus, stress also arises when individuals perceive that they cannot adequately cope up with the demands made on them with threats to their well-being. So basically, we are all in a demand and supply sort of a game, right? Where there are certain demands in our professional workspace, certain targets that need to be met, certain Excel sheets that need to be signed eventually, and it's something like we have got these kind of targets as a teamwork in a corporate atmosphere in various organizations, and then this is something like a stepwise process. So a person who might be sitting in a corporate workspace would be given like around 10 files at the end of the day, and then he has to just accomplish that particular task to get the 11th file on the next day. And it's the moment he's able to accomplish a task of completing the 10th file, there is a likelihood that the stress in terms of workload might increase, and the next day he might be handed at least like 15 files. So the coping mechanism is very important. The coping mechanism is basically an internal reserve of a patient. So internal reserve of a person is very important because if he's not able to cope up with a pre-specified stress, there is a high likelihood that it would just affect his mental health to a large extent, and it would also just involve some kind of work related issues, and his performance in the workspace might be affected. So human beings are more prone to prolonged periods of elevated activity of acute challenges. Challenges are compounded with the presence of neurological ailments. Brain, as we understand, is a key organ of stress response because it determines what is threatening and therefore stressful, and also controls the behavioral and physiological responses to potentially stressful experiences. So very importantly, as I mentioned, coping is a reserve mechanism. Coping is something like a natural defense. So like the way we have our immunity against the infection, we have coping, which is a natural defense of our mental health against any kind of a stress. So coping is expending condition conscious effort to solve personal and interpersonal problems and seeking to master and minimize and further tolerate the stress or conflict. And this ability of to cope is basically dependent upon the mental health of the person. So this is very important because the person has to be having a proper willpower, a proper integrity. He has to be having a proper analysis and a proper judgment in order to cope up with the stress well. So talking about various conditions, like what we frequently encounter in the corporate workspace, or in any kind of workspace, as a matter of fact. First and foremost is the headache disorders. Now, headaches are the most common conditions which we often encounter. Anybody in the lifetime, in the lifespan, might have encountered a headache and is able to understand what exactly a headache is and what is the response of the headache or the entire body to that particular process. So basically, headache is a painful response in the head and the scalp region, resulting in some debilitation. It often results in loss of work hours, inability and decreased performance at personal and professional level. There would be irritability and behavioral changes, which are often associated due to pain, resulting in poor social life. And eventually, it results in increased cost of medication and hospital visits, which add on to the financial burden. For a workspace, we often just count the number of headache hours as the work hours which are being lost in the professional workspace. Like an example, if I'm having a headache, let's say like 4 hour on a daily basis or a 3 hour on a daily basis, and that is from, let's say, between 10 a.m. to 2 p.m. So from 10 a.m. to 2 p.m., my work capacity, my professional ability to take up work would definitely be affected because of the headache or the pain prodrome in place. Similarly, the neuromuscular disorders also result in a lot of stress. So, what exactly is a neuromuscular disorder? Neuromuscular disorder is any kind of weakness in the nerve, what we call it as neuropathy. Weakness in the muscle is what we call it as myopathy or dystrophy, or weakness in the neuromuscular junction, like myasthenia gravis, results in prolonged and frequent disability. So we see a lot of patients who come with all sorts of disabilities, and we understand that in, like, it could be a diabetic neuropathy, it could be something like a leprosy in place, it could be something like a uh, autoimmune condition in place, as a matter of fact. And then we understand that any neural weakness, any neuromuscular weakness is such a big deterrent that the patient has to be rehabilitated in a proper manner in the professional workspace. So let's say a person is been working in a corporate work office, and his work is basically a behind the desk job, as we understand. But because of his neuropathy, he wouldn't be able to type, he wouldn't be able to write, he wouldn't be able to grab hold of things. His ability to go to the washroom might be debilitated. He might be having some kind of debilitation going to the mess in the food areas. So this is how he has to accommodate, and even the workspace also needs to be accommodating that person who's been having some kind of disability. So disability results in poor participation in professional and personal workspace. Disability results in social stigma and depressive disorder, due to which a good cognition, where the patient has got a good cognition, has a feeling of being left out in the workspace. The person would not be getting that kind of attention because there is always a sympathetic approach to the patient, to the person, whereas it should be an empathetic approach from the organization towards the patient, so that he is able to overcome the disability. And if there is a disability in place, there is some kind of occupational sensitization by the supervisors, where he's able to adapt more towards the workspace, thereby saving his job. And he does not have to go out for a long leave, or he does not have to leave the job just for the sake of it. Similarly, cognitive disorders are something which bring about a lot of stress. So all cognitive disorders, be it dementia or a dementia-like ailment, results in poor mental health. So what happens in dementia is that there is some kind of cognitive slowing. People have got like difficulty in recalling the names. They have got a difficulty in short-term memory retention. They have got a difficulty in registration of simple commands, and sometimes the execution part of the command often just result in a lot of errors. So these disorders result in psychosis, mania. Patients would be depressed. They would be often having some obsessive compulsive disorders. They might just have a tendency to just keep on repeating the same task again and again. This results in difficulty in coping to the physical stressors, owing to impaired performance and cognitive disabilities at workspace. Similarly, poor work, poor memory and cognitive disabilities results in financial losses at workspace and errors of judgment. If the person is not able to maintain the files, he's not able to maintain the financial transaction, it might hurt the organization on a long run as well, where the cognitive disabilities often interfere with the person's work performance. Sleep disorders, most common. This is the most common thing. The young millennial, young adult often comes to us that, doctor, I'm not able to sleep. And this is something which is perpetually visible. There is increased screen time, increased time on the phones, laptops, iPads, you you name it, and the person has got it in the kitty or back at home. The lack of sleep or poor pattern, snoring in the night time resulting in sleep apnea are common disorders that are seen in younger to elderly population. So we see that whatever the disorders, like we used to often encounter patients coming from 60s to 65 years of age having difficulty in sleep. But nowadays, the age of onset of a sleep disorder is far earlier because of a sedentary work life. People are who are just doing sedentary behind the desk kind of jobs. Their physical activity is very limited, resulting in a lot of belly fat, resulting in a lot of truncal obesity, which makes them more prone to snoring at the night time. Snoring at the night time results in decrease in oxygen tension in the brain, which results in frequent nighttime awakening, and the patient might wake up not being fresh. He might just say, okay, I just want to sleep like half an hour more, and then I'll be absolutely fine. And that half an hour never just ends. If it often results in daytime sleep attacks and poor work performance. Now, sleep is something which is very essential for memory consolidation. So, and lack of memory eventually will result in poor results in personal and professional domains. And lack of sleep manifests thereafter with something what we call it as a depressive ailment. So, insomnias manifesting with anxiety, manifesting as a depressive ailment is often the spectrum what we see in our clinical practice. Now, being into the domain of neuroimmunology, so autoimmune disorders is something which is a very fresh, which we got to understand in the last decade, that there is a piling on effect in autoimmune disorder. That some patients might just come with a episode of a single episode of what we call it as a seizure or a fit or a convulsion. Then they would be having some kind of altered or confusional states in the brain, what we call it as encephalopathy. They might be getting admitted. Now, these are all young adults. These are all young adults prima facie, which are less than 50 to 55 years of age, where we often encounter these kind of ailments. Like the commonest is multiple sclerosis. So multiple sclerosis is one such ailment where the patients are mostly young adults. And we see that whenever the patient has got a relapse or any kind of a recurrence in his symptoms, the disability keeps on mounting. At one point in time, he might be just having some kind of difficulty in walking. The next time the person just turns up into the workspace, he would be having some kind of urinary incontinence. And similarly, we understand that that the patient needs to get admitted more frequently. He needs to be there on these medications, what we call it as immunomodulator medications or immunosuppressive medications, which are very expensive. So the high cost of medicine and frequent hospital visits bring a lot of stress to the family. Increased cost often drains the family and increases the stress over the caregivers. So this is what we need to understand. It's not only the neurological, the person having a neurological disorder who might be having stress. The caregivers associated with him would be also feeling the same heat. Like I'll just give you an example. We often see patients with, let's say, an ailment like multiple sclerosis. Now, the patient would be a young adult, let's say 40 to 45 years of age, involved in some kind of a corporate MNC sort of a job, resulting in some kind of paralysis. Now, he's got a wife and 2 kids to feed upon. And then he understands that he has to go to the hospital on a frequent visits. And the entire insurance covers eventually gets depleted because of high cost of medication, and then he has to be there on a maintenance cost of the medication. Now the maintenance cost of the medication is on a monthly basis. So a person who like a person like him who would be earning, let's say, 70 to 75,000 rupees on a monthly basis, might be spending close to 40 to 45,000 just on the cost of medications, that too on a monthly basis. So this is the kind of financial sting the person and the family has to often bear. Now, how to prevent stress? So basically, first of all, we have to understand that the neurological ailment what for from which the patient or the person is being suffering from, that has to be dealt with at the earliest. We ask our patients to get in touch with the neurologist, come what may, whatever might be the ailment, get in touch with the neurologist, right? Just rule out a neurological ailment to start with. And then subsequently, the preventive aspects are often like indulge into Mediterranean diet, fruits, vegetable, whole grains, nuts, seed, olives. So should eat what the Mediterranean people often eat, right? More of seafood, fish, right? Wholesome food like poultry, chicken, duck, turkey, eggs, Greek yogurt, cheese, vegetables like tomatoes, broccoli, the Italian type of diet. It's often being stressed upon. Like, why do the Italians live a lot? They basically binge upon having pizzas and pastas and wines, but still we see that the ages the average age of a person is beyond 85. Why? Because fresh quality of cheese is there, and then definitely red wine to a certain extent is results in some kind of preventive aspect, but we often deter our patients not to indulge into alcohol intake. Fruits and berries should be involved in the diet, and avoid the trans fats. So what exactly is trans fat? Like, whenever we see the halwai cooking some samosas, we never see the halwai changing the entire oil. So what happens when we keep on cooking with the same oil? There is a process that the food product would be cooked in that particular oil or oil medium would be having a lot of trans fat. So trans fat results in direct increase in cholesterol and thickening of the blood arteries and the blood vessels, resulting in strokes or cardiovascular event. Similarly, processed meat results in weight gain, obesity. We see like childhood obesity is something which has been coming up off late. Metabolic syndromes occurring in younger patients because of processed meat. Similarly, red meat, added sugar, candies, ice creams, and refined grain, they all pose a risk to any neurological or a lifestyle related ailment. Adequate physical health is very important, right? Because adequate physical involving daily exercise, indulging in sporting activity, brisk walk. Now, often the patients come to us like, doctor, what kind of activity should I be indulging into? So if a patient is less than 40 years of age and the person just asks, so I always tell that walking is not enough, yoga is not enough, indulge into a sporting activity, play a racket sport. That's the best way out, where a one-on-one interaction with an opponent is there. Indulge into brisk walking, yoga, and pranayam. So these kind of uh, issues have to be these kind of additives can be considered when the person is beyond 50 to 55 years of age eventually. And yes, indulging into sporting activity at the earliest to be started. Now, what does this daily exercise result? It result in all kind of as this figure suggests, that all kind of positive effects, the positive endorphins, that just all happens with a daily physical exercise, yoga, pranayam, and better mental health often results in this. Now, if the person is being having a mental health issue, this is very important, because it's not necessary that it could be only a stress. It could be a mental disorder which would be masking as just a mere stress to the other person, right? And it might be a severe disorder in the background. So address the mental disorders very early. Get the help of a neurologist, psychologist, and a psychiatrist early into the stage. Increase the reserves of coping mechanism by positive thinking is something what we often let our patients and family members know of. Meditation, yoga, and deep breathing exercises are other additive measures that anybody and everybody should incorporate in their lifestyles. So with this, I will just end my presentation, and I would be open to all the questions, whatever they are. Yeah.
Thank you so much for the session that you led today. Everybody, you can raise your hand or you can put your questions in the chat and we'll address them.
Sir, are you able to hear me?
Yes, yes, loud and clear.
Okay, so firstly, thank you very much, sir. It was very knowledgeable session and it was very interesting and you have covered. But I just want to understand that what are the initial, symptoms that we have to, okay, I want to, what are the initial symptoms that, okay, this guy is really needs a help. So how to do the, observation on it? If you can guide and
So there are two ways to look at it. First of all, we need to understand whether there is any kind of neurological disorder in place, and because of which the person is being having some kind of stress, he's been having some kind of stress, or it is only primary stress to start with, and there is no neurological disorder in the background. So just to start with, like if a person is being complaining that he's been having some kind of stressful conditions at work or in the professional workspace, the supervisors are the ones, or the team leaders are the ones who really need to be, first of all, taken into account, that there has to be some kind of a one-on-one sort of a discussion with the person or the patient, that what exactly the stress is all about. Is it personal, is it interpersonal, is it familial, is it financial, is it at the professional workspace? To what extent the person is perturbed about it, right? Whether that particular stress is making him avoid the workspace, he's not able to just face the peers or the other people at the work because of that particular stressful condition, that has to be addressed too. And there many a times, if there is only stress in place in isolation, not in the background of a neurological disorder, the person or the patient really needs to seek an opinion from a psychologist for a counseling, and then subsequently, if need be, a requirement of a psychiatric session would often be helpful on a long run basis to get better work outcomes and a better positive way of life. In the background of a neurological disorder, I understand that many patients, uh, let's say like a patient of a migraine, right, a very simple headache sort of a disorder seen in workplace. If a person is being having migraine, now the migraine attacks are so debilitating that the patient would tend to just miss out at least 1 to 2 days of work. Now often the employer doesn't understand कि चलो headache ही तो है, सभी के होता है. But
correct.
those attacks have to be looked into with all empathy and compassion, and the patient should be stressed that he just enters into the domain of a neurologist on a regular basis, that he should seek the opinion in order to avoid those attacks. Now the thing is that these kind of all the neurological ailments I'm talking about and I just addressed, they are not curable, but they are treatable to a large extent. They can be prevented to a large extent, but all of them have got a treatment. Nothing can be cured. In all the super specialty branches, be it diabetes, thyroid, kidney disorders, they can all be treated. They cannot be cured. So you cannot resume your pre-existing level of health, what you were, let's say like 15 years back, because now you have encountered an ailment and the ailment will require a long-term support. So we need to understand that this condition might bring out some kind of stress, some hospital visit to the patient, a financial deterrent can occur. So the compassion has to be there amongst the employers, the understanding ability has to be there, and simultaneously the patients should also be strictly following their doctors or their neurologist for a preventive checkup, because we understand that patients often just default upon their regular follow-ups. It is not like that in the Western context. In case of a Western context, when a file of a patient is being made, the patient is being asked to come to a specialist for a repeated follow-up. But here, if the headaches are gone, if the seizures are not there, if the fits have gone, they hardly do come up for a follow-up. So the follow-ups have to be insisted upon. Compassion from the workspace and the peers and the employers has to be insisted upon, and simultaneously some kind of empathy to be levied upon to the patient and the work and the caregivers, where in order to just make them more accommodative and rehabilitative for the particular area.
Okay, yeah, I got it, sir. And any doctors have any test or something, which can we can any chemical disbalance which you can suggest. Okay, for your, because we are keep conducting routine test. Any test or anything which we have to add on it, sir?
The basically the thing is that these blood tests, these are all routine blood investigation. For a patient, let's say a patient is being having epilepsy, right? He's being there in the workspace. Now these routine blood investigation will have a limited importance. Now, whether he's been going to the neurologist where certain tests like EEG is being undertaken, where a control of the epileptic fit has to be understood, right? So, in when the patient is there on a follow-up, we hardly do any kind of test. It's the history taking, that whether he had an episode, whether there is a chance or a likelihood of having another episode, be it in the workplace or in the home or in the transit. It could be at any place. So we need to just understand that particular risk. And then we have to ensure the routine blood investigations are just the routine preventive, what we call it as a preventive blood work. So one should get it done on a yearly basis. There is no problem regarding the same. And in the background of a ailment, let's say a person is being having a heart attack, then the cholesterol levels are very important on a 3 monthly or a 6 monthly basis. So this would be a preventive, both as a part of the management strategy. But for a routine person who is not affected by any ailment, I think so. Just a yearly blood work would be just like more than sufficient.
That's a good input, sir. And another point, sir, which I would like to add. See, as our field, there's a lot of challenges, challenging situations are there, right? And people are keep traveling, right? So in that case, if the because customer is also very demandable, because we are at the service side, we have to deliver the network, right, sir? So because people are away from the family and they have to keep travel, they have to give the results. So sometimes what we are observing, we are getting very negative inputs. Okay, no sir, we are not able to do it. They are completely losing their confidence level, and they come out with the negative thought process. So what will be the, in that case, how to handle such type of the situation, because it is more towards the completely on a this example which you have right now mentioned. So what will be the your input and the advice in that case for such type of the team members, and how to handle, and what should we have to take as a proactive action on it, sir?
Again, two ways to look at it, right? One is any kind of, if the work related stress is resulting in some kind of deterrence in the mental health, it has to be addressed by a psychologist. It has to be, there is a hierarchy in place. So let the team leader or the supervisor just come into the entire ambit, and they should understand, they should undertake this kind of a endeavor, that this person is being having some kind of negative productivity at the workspace because of some kind of issues, and this has to be gradually addressed by the team leader, by the supervisor at the incipient stages. If not, then a psychologist comes into place, and thereafter the psychiatrist. Whereas for a neurological disorder, let's say like a person needs to travel, and in that time frame there is a follow-up of a neurologist, or a follow-up which is being due, or some kind of test which is being due with some clinician, where he might be just following it up for a neurological disorder, then it could just result in some kind of a conflict. So that has to be addressed. So what can be done is, as we understand, if the mental health of the person is getting affected, psychologist, psychiatrist, this is where they come into place. And if there is a background of a neurological ailment in place, neurologists often give them a good ear, a good understanding. And yes, our intent is not to make the person homebound. So we often tell our patients like, okay, you had a stroke, right? But मेरा काम आपको घर में बिठाने का नहीं है. मेरा काम आपको वापस वर्क पे लेके जाने का है. So the occupational therapy has to come into place. The work related, the rehabilitation is a very important part of it.
Okay. Got it, sir. Got it. I have noted your points. Yeah. Thanks. Thank you very much for your valued. Right. Sir, and this will happen with all the age group. It calls for the childrens also, or it is just for the So it's
As a neurologist, I see anybody from beyond 1 year of age to till 100, right? So all the spectrum comes into our ambit. So we understand patients of autism, young children with seizures, epileptic fit do come across. They miss their work, they miss their schools for a long period of time because of these episodes. So we make them understand. We take a, very holistic approach. We discuss it with the parents. Many a time we understand the teachers come into place. So I'll give an example. If a person is being having epilepsy and he's getting married, so
Mm.
he'll bring the spouse, he'll bring the entire in-law side, so that just in order to just clarify about the questions regarding epilepsy, which is often very the patient might be just like put in an improper line if he just searches on a random search engine or Google, right? So this is how it is. So we provide all kind of assistance. So this is what we call it as holistic approach in neurology.
Yeah, yeah, sir. It really, really, it's highly appreciated, sir. Yeah. Any other question, team, or from anyone?
I'll just take a point here to suggest what has been suggested by Dr. Kadam is this that to all my people out here who are here in this particular part that key prevention is better than cure, which he said about physical exercise, he said about pranayams and like meditations. I believe these are the things which we all must do to in order to be relieved from the stresses which are there. I'm very sure that these can really uh, take all of us who does this religiously on a daily basis. Otherwise, because what is our we have I've read somewhere something about neuro, we have something called NLP, right? Neuro linguistic programming, with which people tend to like don't want to do the meditation. Suppose they want to get you have to get up at 6 o'clock. He said, "Let me sleep for more half an hour and avoid that." That will actually, uh, you know, uh, not help in relieving from the stress. Thank you very much, doctor, for taking us through these, insights. And I believe that the people out here who are listening, they have listened it properly and will follow the guidelines which has been shared. Thank you.
Is anybody else? Do you want to raise your hand? You can raise your hand. You can put your question in the chat.
Yeah, miss. I want to ask a question.
Yeah,
My name
please.
is Rahul. So I want to know, like, if a family member or a colleague, I am clearly able to see that this person is very overthinking and very anxious in nature, and I want to know, like, how to convince them so that they can actually seek for professional help like psychiatrist or psychologist, because I am clearly able to see that this person is very anxious in social condition and very negative thought process about everything. So when I talk to that person to like how to deal with it, or you can seek a medical help, so that person considers me as a enemy. So that kind of situation sometimes comes. So how to deal with that, and how maybe convince that person to go to adopt.
So sometimes what happens that anybody can get offended, right? There could be a possibility that nowadays there is a high likelihood that if there is a psychiatric disorder in place, or a person requires some kind of really good help from a psychiatrist, right? Then they often get offended if they are being told. We have seen people coming from all walks of life. So these are not the illiterate patients I'm talking about, right? Coming from the
Yes.
village or the rural areas. These are the urban patients I'm talking about. So what we see in our clinical practice, if we just like let them know, okay, looking at their history, understanding what exactly the problem is, and we think that there would be a requirement of just seeking a help from a psychiatrist, because as a neurologist, I would like to understand, is the patient having a neurological disorder or not, right? If the patient is not having a neurological disorder and it's a psychiatric disorder, then the psychiatrist has to come into place, right? I have to convince the patient to go to a psychiatrist, but there is a high likelihood that the patient would not want to visit me again because, okay, Dr. Kadam has said to go to a psychiatrist, and I think so. There is no psychiatric problem in place. The person or the family members are often there in denial to start with, but
Yeah.
at the end of the day, probably like a couple of months down the line, when they keep on finding that there is some kind of an issue in place, they would, I would just say, the good sense prevails eventually, and they would definitely reach the proper direction in time to come. Sometimes giving additional advice might be problematic. That's why we often just address in like we ask the workspaces to maintain a committee, right, where they have a psychologist visit in place, they have a physician's visit in place, and people who are there in high demand job, often traveling in and out of the city in a MNC, improper work hours. Sometimes they would be requiring that kind of counseling. They would be requiring some kind of just a wee bit of advice to get the entire process in place. And there would be, and the psychologist, I would believe, would be the right person who would be able to weed out that who exactly would be requiring a help from the psychiatrist eventually.
Okay. Thank you.
Guys, anybody else? You can unmute yourself, you can raise your hand, you can put your question in the chat. Big, small, whatever question you have, please feel free to ask your question. Got that, Ratan? Kadam sir, one question I want to ask from my end. You mentioned OCD there in your slides. Like, what exactly is something which would define from somebody being, just let's say it's pertaining to cleanliness. Somebody just being cognizant that, he wants that cleanliness to somebody getting, in OCD.
So there is a terminology, what we call it as perfectionist, that you want to get into the detail of the job,
Yes.
right? Into the fine detail of the job. And
Yes.
then there is a person who would be having obsessive compulsive disorder. Now, obsession is that there is an obsession to a particular task. Like if I'm washing my hands, I would be obsessed with washing my hands, right? I would be doing that task very meticulously again and again. And then there is compulsive. I wash my hands, I sit on my chair, and there is a compulsion and an inner urge to again wash my hands with the same kind of an obsession. So there is a lot of difference between perfectionist who works with precision and there is a OCD in place where the task there is no execution of the task. Try to understand a perfectionist, like I want to just do this particular, I want to just create an Excel sheet which has to be perfect, right? I'll give an example. On the contrary, I have a person who would be just forget about the Excel sheet. He would be just like busy washing his hands. So this is what an OCD looks like. And if we just like draw out a comparison with the person who really wants to work with precision. So there is no execution of the task. It is just a repetition of the particular pre-existing activity. That if I want to just do my bed sheets, I would just like keep on doing it. Right. So it's not that the bed sheet would be just like maintained in a very perfect sort of a way, but the person would be engaged and in an obsessive and a compulsive manner in order to keep on doing so.
Got it. Got it. That's really, it demarcates both of them for me. Anybody else? Any question you have?
No, Shikha.
Yeah, yes, nobody has. So
Got it.
That makes my job easier.
Got it. Got it. Thank
okay,
you so much.
All right, pleasure
Kadam.
seeing you all.
okay,
It's
thank
it
you,
was
sir.
a pleasure
Bye.
to be with you here. Thank you so much. And thank you everybody for being here, for making to this session. I hope it added value to your day-to-day life. And we'll reach out to you certainly for feedbacks. Thank you so much for making yourself available today.
Thank you, thank you.
Thank you.
Thank
Thank you.
you so much,
Thank you,
Thank you,
everybody.
doctor.
Bye bye.